right in between the spinous processes. There's little muscles, there's little ligaments, little tendons. You can actually scrape the bone. Okay, roll on your back and let's see. And then I'm pulling straight towards myself, not in the direction that my elbow is turned. I think I just heard a little plop.
Yep.
Yeah. Was that down in your back?
Mm-hmm.
Right in that spot?
Yep.
Yeah.
And the same?
The place where he was with the T-bar and the brushes.
And you see, it's my legs that are doing the work here. I'm pushing. If I had a table with more leg room, I'd have my legs straight out and I'd be actually pulling. Now, can you imagine if you had a device that was hooked to your chest? Now I could have both hands free to be feeling where C1 and C2 are and working with them at the same time as I'm pulling and using my legs to traction. It's going to be awesome. Well, the hook here is no problem. It's putting something on here that doesn't compress the TMJ at the same time. See, I don't want to be pulling on her jaw. Now, do you feel it all the way down to your sacrum?
I don't feel it where I was feeling it.
Yes.
I feel it a little bit inside my shoulder blades, just right there. I don't feel anything here. Like, it just feels open.
Yeah, okay. So we would mark that down or go and work on that if we were actually doing the treatment. Now, there's a membrane that attaches to the occipital protuberance, a membrane that hooks to the durotube. So
To the
you
what?
can,
Sorry?
the durotube, down through the hole in the spine, there's a tube that runs all the way down. Inside it is cerebral spinal fluid. Inside the fluid is the cord. When you take the pelvis course, there's a direct connection between the hip bones and the temporal bones, the iliums and the temporal bones, and the sacrum and the occiput. And we won't be teaching that here. And also the durotube, sometimes if the pelvis is really off, it can be pulling in the durotube all the way up into this area. It could be jamming this up. The durotube, when it comes up into the skull, becomes the inner lining of the skull bones. It balloons out. It also divides the brain into 4 quadrants. And so theoretically, if it's pulling down there, it can actually even distort the brain. A really interesting couple stories, meaning one of his iliums was smaller than the other. So the ischial tuberosities that we sit on, one side was higher than the other. So when he'd sit down in school, his pelvis would tilt and he'd have to correct, he'd go into some scoliosis pattern. From was that the durotube was pulling on his brain. And as soon as he would stand up, that pressure was gone from his brain and he could think straight. And the kid knew it and told everybody that came around, but no one listened or no one understood. It will fit right into that lamina groove beautifully and work all of those tissues in there. Now, if you have a muscle running from the spinous process of this vertebrae over to the transverse process of this vertebrae, of course, it will cause the vertebrae to rotate. And so if you were running your fingers down the back and you saw the spinous processes all lined up and then suddenly they're all over to the right, it's because there's a erector muscle tight in there. Now when those goes over, this little facet joint here gets a little extra pressure in it, and that sends a signal to the muscles telling them to splint the area. Now if you've ever had a chiropractic adjustment, they can take that pressure out of the facet joint. You have given some wonderful relief, but if the muscle was causing the subluxation to start with, going in and actually releasing those muscles that were causing it in the first cause, more of a permanent relief. Okay, so you can work through there. Then you can take the little tool and work right in between the spinous processes. There's little muscles, there's little ligaments, little tendons. You can actually scrape the bone. So let's do that on her. So I'm going to use this little scraper tip, we'll call it, on the precious tool. And you see I can go right in between the vertebrae. Okay, for this OA release, the occiput and atlas can get very, very tight. The suboccipital muscles can be quite tight. And again, the wedge part of the precious tool is just perfect. And if you bring it in at almost like you're setting the whole tool down on the person's head, and then bring the tail up maybe an inch or so, you'll find that the part of the tool that's going to slip into that OA joint is then at just about perfect angle. I have the patient with her chin tucked a little bit towards her chest, which is going to open up this OA joint. I'm sitting down. One of my arms is laying on her back. My other hand is on her head. Now the really nice thing about this tool, one of the nice things is if you come across a muscle, because of the shape of the tool, it will just lift up and over and not catch on that tight muscle. The tool will lift itself right up. Now there's probably a nasty spot right there.